Viruses are becoming more resistant to antibiotics. Madison Miller explains why epidemiologists say more money needs to go into developing new and improved vaccines.
Healthcare officials that recently attended the Arizona Health Journalism Conference in Phoenix say that disease outbreaks are becoming harder to detect and treat. Siva Shapar, director of epidemics prevention team at the nonprofit Resolve to Save Lives, says that we need to put more research into new vaccines.
These are living organisms that evolve and adapt, and so the medicines we have to treat things like bacterial infection, there hasn't been a lot of progress in coming up with new medicines.
Shapar says that he creates possible vaccines for different outbreaks. But for example, the strand that worked in January to get rid of the flu might not work in July because the virus has had time to adapt and evolve.
Just because you get a flu vaccine for, say, type A of a certain type, if there's a different type of flu out there circulating, you're not going to be protected, and that varies from year to year.
Even the ways they create the vaccine can be part of the problem.
There's some changes in the way we make flu vaccine in eggs. There's some adaptation there that can cause small changes. So all of these things and some other things lead to the fact that it's not necessarily a perfect match once the flu vaccine comes out.
Epidemiologist Sakia Popescu says that people don't have to rely on vaccines. They can prevent an illness outbreak in other ways, like finishing a dose of antibiotics and coughing into their elbows.
Hand hygiene is like the one thing you can do that's really going to make a difference. It's surprising. I don't think people really give it the credit it deserves.
All things you could do to help prevent the spread of germs when you are sick. In Phoenix, Madison Miller, Cronkite News.
Shapar urges people to get the vaccinations that are available to protect their health and the health of the community.